Well, good afternoon, wherever you are in the world, or good morning, or good evening, whatever time of day it is with you. I'm speaking to you from London, where it's a very wet and windy day, and it's a great pleasure to be with you. Wherever you are, you're very welcome to what is the 231st ICMDA webinar. And the topic today is distance education in healthcare management. And our brother, Dr. Santhosh Mathew, is going to speak to us about this in a moment. Now, I'm sure you all know about ICMDA representing Christian medical fellowships in 107 countries across the world, in 14 regions. And we have, at the moment, I think we have 79 field workers. And training has become an even more important part of our program since COVID. And since the pandemic, we've become aware of the benefits and opportunities that come from training online. So that's been a real blessing. And my background is in healthcare management. I've been in 10 years in the National Health Service, in working in a NHS as a chief executive of a teaching hospital, but then working in countries around the world in healthcare management. So I have a particular interest in this topic. In fact, it was during COVID that Peter and I and others at ICMJ were particularly interested in providing help and information to mission hospitals in Africa and other parts of the world that were suffering from COVID. And so we started developing a database and found that there were over 2,000 mission hospitals in Africa, Christian mission hospitals in Africa and Asia at least. And really coming out of that, and from the success of the diploma in family medicine, which has now been running for 3 or 4 years, it was thought that it would be a really good idea to develop an online diploma in healthcare management to be able to support those who are often unable to access information and training. And as it says in the publicity for this, there is a real lack of trained healthcare managers and leaders who can efficiently manage healthcare institutions in resource-limited settings. So having decided that we ought to pursue this, Santhosh has led the work over the last 2 years at least in developing this program. And I've been on the working group. But today, I'm pleased to say we are able to announce that it's launched, it's on the website. And so we can invite Santhosh to tell us more about it. But before that, I'll tell you a bit about Santhosh, who is, as you know, the training director for ICMDA. And he's developing an online learning platform across a number of different areas. He trained as an internal medicine specialist and worked part-time as an internal medicine consultant in Duncan Hospital in India, a 225-bedded hospital near the Nepal border. He pioneered HIV and TB healthcare programs in marginalized communities and is involved in hospital leadership roles across North India. He's married to Sarah, an anaesthetist, and they have 2 children. So without further ado, it's my great pleasure and privilege to hand over to Santhosh and to ask him to speak to us about the new distance education in healthcare management diploma.
Thank you, Howard. So in the next 25 minutes or so, I'll share with you some aspects of some introduction to this healthcare management training program which CMC, Valor, ICMD, and Loma is putting together. But before that, I'll take you through a little bit on the context of health management today and what is the need around and how did we come up with this program and some details of the program. Let me start with my own journey. I remember working as faculty in Christian Medical College in Louisiana in the Department of Internal Medicine and Nephrology, and we took a decision to move out from academics into a rural mission hospital. I was early 30s. I walked into this hospital, and within a month, they said to take over the whole lab, X-ray, and pharmacy. and plan the whole thing, manage all the team, manage it. I said, I have no idea how to manage departments, not people. People management, what not my skills. He said, no, you can learn it on the job. Just do it. And for the next 3 years, I was running this 3 big departments in a 200-bedded rural hospital, learning everything on the way, with no absolute interest or training in it. And then I started praying and asking God, never allow me to do this again. Ask me to do it again. I don't want management. I don't want leadership. I just want to practice internal medicine. 3 years down the line, we moved to another hospital where there's a need. And I was running the institution as the head of the institution with over 100 staff, 70 beds, 2 million rupees in deficit, no money to pay salaries. And I asking God, Lord, why did you ask me to do this? Never tell God you don't want to do something. He'll make you do it. But the encouraging fact was, as I looked around in our network, we are a network of 18 or 19 hospitals. Almost all leaders were like that. Forced into leadership, quote unquote forced, due to circumstances, learning things on the way, and most of us were ill prepared. Had no idea of how to manage people, forget money, finances, the nitty-gritty details of hospital management. We had no idea. But things have changed along much from that period. Today, you find a large number of trained MBAs or healthcare managers coming into some of the rural hospitals. But the challenge is, like medicine, which becomes specialized, management also has become specialized. So you're getting HR managers, finance managers, material management managers, marketing managers. But the problem is that the rural hospitals or semi-urban hospitals or for-profit, not-for-profit hospitals or mission hospitals or faith-based hospitals cannot afford to have multiple specialists running multiple departments. And what you need is a multitasking, multi-specialized general practitioner of management, like the family practitioner, because it's much more complex. The rural healthcare and the not-for-profit hospitals in resource challenge settings, it's much more complex in terms of sustaining it. So in this context, we need to look at this whole management training. Why are we doing this management training? The third aspect is the complexity of healthcare and hospital management. I want to kind of pick up a few things from this. If you look at not-for-profit hospitals, you've got the faith-based hospitals, you've got the cooperative hospitals where people come together as a cooperative, or community-based institutions, or some private trust hospitals. I'm primarily looking at this set of healthcare institutions and looking at the challenges they face. There is one aspect of the whole context of service delivery, the multiple systems in the community which practices or involved in healthcare. So a manager or a leader has to interact with all this internal or service delivery structures. On the outside, there are all the other linkages you need to have. You've got the manufacturers, you've got the supply chain, you've got the pharmacy, you've got the referral centers, you've got the donors, you've got the banks, you've got institutions. So a person who leads an institution has to interact both with the service sector and with the other external management. What are some of the complexities today? One of the main complex challenges is staffing. We hear time and time again from across the globe, from rural hospitals, mission hospitals, and faith-based institutions, there is a huge staff shortage. And staff are stretched. Brain drain. People do not want to go to rural setups or semi-urban setups or hard to reach areas. And so there is equally a challenge of burnout. You're doing multitasking along with your clinical work or your nursing work or your other work, management, they're burning out. There is also the financial constraints. The cost of healthcare is rising. Even in countries where there are reimbursement models or insurance, there are all complexities of repayment, payment not coming in time, and all this leading to major challenge of sustainability. Many studies done in mission hospitals and not-for-profit hospitals have shown that there are two major issues which the hospitals are facing. One is governance, the other is systems of management. Church-based institutions with all the complexities of how churches want to manage institutions, other players who have say into governance, all these complexities are creating governance challenges. Equally, though in the corporate side or the commercial side, management systems have improved fast, many of these hospitals are still lagging behind in setting up good, efficient management systems. Of course, in the middle of this, the patient expectations are much higher. They'll Google, find out their diagnosis and come, and they expect a particular way of how service should be provided. And there is definitely much more focus on quality and safety, which is very important. COVID has taught us that we are not prepared for emergencies. Though we've played a major role during COVID, many of this was again makeshift arrangements or learning on the job. If only we had been prepared. Similarly, in the last 5 years or so, technology has become a major driver. Health records, electronic health records has become mandatory in many countries. AI will completely revolutionize healthcare management and healthcare itself. Interestingly, some of the major issues which are happening in big institutions is cybersecurity. We may not face it today, but we will definitely face that tomorrow. In the middle of this, countries, states, governments are becoming much more aware that systems have to be in place. So there is this regulatory compliance. Gone are the days when you could run a hospital and say that, oh, this is how we do it. You can't, because there are much more regulatory compliance. Supply chain is becoming a major issue because just a practical situation with Novo Nordisk going into semaglutide and all the new molecules. Insulin is completely out of the market in South Asian region. Why? Because pharmaceutical companies have changed their directions. How do you manage where there is, supply chain issues, especially in the context where conflicts are happening, wars are happening? And there's more and more realization that if you want to make a difference in the communities, in the health of communities, or in the health of a nation, a hospital cannot do it. A hospital has to manage it along with the social determinants of health. You need to manage in an integrated way the chronic diseases, the aging population, the emerging challenges like mental health. And for that, you cannot sit in a hospital and manage. You need to hold it together with an integrated program in the community. Of course, the environmental responsibility and the competition from the market forces who are much more ahead in innovation is a major challenge. Faith-based organizations have been very good in looking at public health practice historically. If you look at the history of primary healthcare, it came from Christian healthcare institutions. So we are good at looking at risk behaviors, health education, healthcare, case management, and looking at the current public health issues, though some institutions may not be doing it. But more and more, there is a realization that unless the social inequities, the institutional inequities, the living conditions, the social determinants of health are not addressed, a healthcare institution cannot make a difference in the community. So which means that a manager or a leader has to be aware and knowledgeable about some of this too. In the last 10 years or decade or so, WHO has pushed for universal healthcare. What does that mean? Which means that every patient, every person, without any caste, creed, religion, or gender, or disability, anything, should be able to access care. So almost all governments have signed on to this. Excellent direction, but that this also brings complexity that institutions have to align to a larger picture of the health system. You cannot run your own institutions detached from the other institutions. You are part of a larger healthcare system and a structure, which means you need to know how to hold hands and partner. In the middle of this is the whole issue of ethics. When money drives healthcare, stories like this will emerge. We need to use equipment to make money. Return on investment is a major issue. Ethical issues are coming up in a big way. Not only clinical ethics, management ethics. At the same time, due to budget constraints, we need people who can multitask, like a surgeon who might be asked to do a plumbing job. In the middle of all this, we also are realizing there's a huge community which is dropping through the cracks. The neo-marginalization, if you want to call it, for the people who are marginalized. And as Christian healthcare professionals, our mandate is to care holistically for those in the margins. That is what Jesus is a role model for us. So what is the answer? As we are looking at during the COVID pandemic, when many people who were part of our family medicine program reached out to us and said, hey, we are running our institution. We have been put into leadership of institutions, but we have no idea what to do with it. Because we are trained in medicine, family medicine, but we don't know how to manage institutions. We realize that unless there's an army of leaders and managers who are lifelong learners, who constantly learn and transform themselves, because the context is changing very fast, are servant leaders who can build people, who can facilitate systems who are patient-centric, but not lose the focus on the poor and the socially excluded. At the same time, work towards ethical, quality, accessible, relevant, and cost-effective services without losing the sustainability of institutions, because funding is no more easily available. Institutions have to become sustainable. It's in this context that ICMTA, along with CMC Vellore and Loma Linda University, started exploring, is it possible to come up in line with the 2-year family medicine, which we have been running for the last 5 years, which about 200 plus people across the globe from about 55 countries have gone through. Is it possible to come up with a postgraduate diploma in healthcare management? This is a tripartite partnership program between ICMTA Christian Medical College Vellore and Loma Linda University. The roles of these three partners are ICMTA does all the course coordination, the registration, the payment fees, the contact center planning. CMC and ICMTA has come together with a group of about 25 global experts to develop the course. And the two organizations together will deliver the program and do the faculty development. And Loma Linda University, California will certify this program. In line with the family medicine program, this too is a blended model. What does it mean by blended model? You have, on one hand, self-learning interactive modules supported by videos, and on the other hand, you have contact programs. There are two contact programs, one, a monthly online contact program, Zoom sessions, and one offline facilitated learning exposure. So our vision is that through this program, that we would empower servant leaders who are compassionate, who will facilitate systems which are quality, ethical, and patient-centric. And hopefully, due to that, health systems will be strengthened in their countries or in their locations. But at the same time, learn to use the limited resources for the larger number of people without losing the focus on the poor and socially excluded, but founded in the spirit and love of Christ. Our motto is the leaders should be driven by compassion and empowered to lead. Every program which CMC, ICMT, and Loma Linda runs has certain DNA. The DNA means these are the core things we want to hold on. This will be reminded throughout the 2 years people go through the program, that they should be lifelong learners. It's a lifelong journey of learning. It doesn't end in 2 years. They should be people who will transform themselves and facilitate transformation in their context. And they should be servant leaders who will develop and sustain a culture of trust and competence within their organizations. Of course, it is not only internal change, they will facilitate responsive systems which are relevant without losing focus on patients and the poor and socially excluded, and with compassion as our foundation. Of course, they should look at the other aspects which I talked about, and make institutions sustainable. These are the 6 DNAs which we will focus on, and where learners will be reminded in every module to focus on this. So what are the online components of the program? There are 20 modules which the learners will go through. It is divided into 4 major sections. One is the big picture, the foundational issues, which are the health systems and how do you strengthen systems. Second is what we call as the core issues for us as faith-based institutions and faith-based programs. Taking care of the poor, how faith integrates with healthcare, and how community structures and others play a role in healthcare and healthcare management. Of course, the nitty-gritty details of hospital and healthcare management, and specific section on outreach and community engagement or program management. The self-learning online component will be something like this. This is the first module put up for to share. If you look at this, it is systems thinking in healthcare. We start with what does it mean to be a systems thinker, and then each of those will have a learning objective, some trigger questions to challenge, to put out what you know already, and then the introduction, then videos, then take a break to stop and reflect what you have learned, and then interact in the module, and then at the end of each module, assessment. Each of these modules will have voiceover, storylines, visual cues which you can interact, a roadmap for the whole module, trigger questions, like I said, to challenge our own knowledge, feedback to take a breaks or questions, and they are self-paced and personalized. You can take your time depending on the number of days given to you. Every module will have an introductory summary video which will introduce you to the topics which will be covered. This is the module on poverty. You can see that there's the video up there, and so that you can get an overview and then dive into the rest of the modules. A little more detail on the modules. In the foundational issue modules will cover health systems, healthcare leadership, health economics, health policy, and strategic thinking and planning and governance in healthcare. In the core issues, we will cover why should we take care of the poor and socially excluded. How does indigenous and cross-cultural structures and community structures interplay with health and health care? And what is the importance of faith and the concept of shalom in healthcare? Of course, the major component is about 11 months of hospital management and healthcare management, which includes basic principles of management, organizational behavior, patient management, HR, technology, material management, hospital planning, engineering, medical records, finance, legal framework, marketing, partnerships, and quality, and a few others. Community engagement will focus a lot on disaster management and disaster resilient communities, plus epidemiology and primary healthcare, program planning, and then how community-based programs can be done to develop services for the marginalized, and how can you leverage technology for the disadvantaged. The additional components will have one capstone project, a project which the learner should do in a period of 1 year plus. 20 months will be for the online learning. Last 4 months will be to write the project. The project will be introduced at the beginning of year 2, and they will have the whole year to do the research and write the projects. As I said, every month there will be interactive Zoom sessions, picking up on each of those modules and mentors coming alongside and sharing their experience and challenging learning. And there would be one learning exposure in a nearby health or hospital or health program, which will be facilitated. Being a global program, it's important to have the program have a global contextualization. So because many of the modules may not be able to be country-specific examples. For example, legal. Each country has a different legal policy. So the monthly programs, monthly Zoom sessions and interactions will help the learners to contextualize it for their context and look at it from a global context too, because the module will be based on a global context, but the interaction will lead to contextualization for the place from or region from where they are coming. once you complete the course, how can you get a certification, or the postgraduate diploma? There will be ongoing formative assessment in each module, which will be added on to the final assessment. At the end of year 1 and year 2, there's summative assessment or exams. Of course, there is the mandatory attendance in the monthly sessions. There would be weightage for the project work and the hospital visit or the program visit. All this will be part of the final assessment. Who can apply? It is open to all health professionals working in healthcare system. Especially, we want to focus on those in low-income and middle-income countries, but others also can apply. They should have a healthcare degree or management degree and minimum 2 years of work experience in a healthcare context, so that they come in with some understanding of what healthcare is like and how learnings can be put into practice. Of course, a proficiency in English and IT access is important, because most of the learnings would be online. The applications are live. This QR code will take you direct to the application form. I'll show it again at the end. The fees will be at about $2,000 for the whole program. There will be some scholarships available for a limited number of students from host limited settings. How can you get involved? Pay for the program. The applications are just out today, and we are praying that the right people whom God has chosen, God has willed, would come in. We would like people to facilitate the program, the monthly sessions, managers, healthcare leaders who have experience, who can share from their lives. We would like you to invite you to join us in this journey. And we would like all the students, all the participants to be mentored by healthcare leaders in their project, in their monthly sessions, and in their interactions. So be a mentor and promote this in your regions and share with others, like Howard reminded. If there are others who could be helped by this, please share. The course is starting on 10th March 2025. The QR code is up there. If you want any further information, if you go on to ICMD website or CMC website, the website links are here. You can get more details. Thank you once again. I hope through this we'll be able to build a generation of leaders who can change the context of healthcare in rural and semi-urban and hard-to-reach locations, and make a difference for the kingdom through their presence there. Thank you.
Josh, thank you so much for that presentation. I'm getting really excited, and to see all the material coming together into this course, it's a real joy. I felt great sympathy for people like you, Santhosh, gone to all the trouble of training in internal medicine, and that's what you want to do. And then you go to a hospital and somebody says, but we need somebody to do all the administration and management. And so all that work training you've done, you end up doing something that you've had no training in at all. So I think this is extremely timely, especially for those working in mission hospitals. And I hope that those who are listening will not only spread the news, but if you're willing to be a mentor or in some way a facilitator, please do get in touch with us. So thank you for that, Santhosh. We've got one or two questions, but I just wanted to start by asking you, Santhosh, what kind of healthcare professionals do you think will most benefit from the course as we've envisaged it?
The course is open for all healthcare professionals, which include doctors, nurses, allied health, managers, lab technicians, or any. Generally, nurses and doctors end up in management, so definitely it'll help them. But I think the time has come when other professionals like allied health team, other healthcare specialties also should pick up management, because they have the basic healthcare understanding. And you don't need doctors or nurses only to manage hospitals. There are a whole stream of people. So our dream is that not only doctors and nurses, there are many other faculties, that is maybe lab technicians, radiologists, radiology technicians, or others who can move into management will pick up this course and be trained, because doctors and nurses are sometimes limited in terms of time. So if other professionals who can give them more time to management. So we are looking at all kinds of professionals.
Great. Well, I suppose we're also conscious that as well as those being encouraged, in inverted commas, as doctors to move into management,
Yes.
there are those who are have come into the hospital because they've got a degree in business, but they don't necessarily know much about healthcare until they actually land in the hospital. And it seems to me that they would be very appropriate people, whether they are already running the hospital or whether they're on a lower rung and are aspiring to run the hospital.
Yeah.
I think because the scope of what is covered here is really for a generalist, isn't it?
Yes. So that is the other side of it. If anybody who wants to go into management and say, I've got an interest in management, or I've been forced into management because of a need, I think from any specialty, I think so. We are looking at journalists, yeah.
Well, and could you expand on the placements? Because I know, looking at how doctors and nurses are trained, they have the academic side, but they learn so much, don't they, on the job, and also going, watch, if you're a surgeon, you stand alongside the surgeon, then you get to do it yourself. How are we going to do that with healthcare managers? How are they going to see other people doing it better?
So in the family medicine program, we have 5 global centers, 3 in Africa, 2 in Africa, 1 in Egypt, 1 in Cambodia, 1 in India, 1 in Pakistan, where students go for a week and go through a facilitated learning time. We're looking at the same model whereby not 5, based on the context, locations from where students are coming in, or countries, regions from where students are coming in, identify hospitals in those regions or the countries, have a understanding with that hospitals, and encourage students to go there and spend a week with specific learning objectives. They would be given a specific learning objective, and the local team, they will observe what the local team is doing. They look at what the best practices are, or what needs to be improved, how different it is from what they have seen, and then they'll come back and have an interaction with the faculty and leading team. So that's what we are planning. The centers are not yet identified. We're still in the process of working through that because it's the first cohort which is joining. So by middle of this year, we should have those places and locations trending.
And I suspect that that's part of the diploma that is going to expand over the years, because I vividly remember, can still recall over 50 years ago, my first 3 months working in a hospital and just going from department to department and seeing how those departments are run. And that's something that kind of exposure with somebody as your mentor or facilitator stays with you for the rest of your life, isn't it? So it's really important. We've got a few questions coming in. Timothy Hardcastle says he's happy to get involved in helping on the disaster component. So, Timothy, you're very welcome. You were part of the WHO team who developed a course in disaster medicine, and it looks like you're in South Africa, is that? ZA? So, yes, please, we'll either get in touch with you, or Santhosh will, or do get in contact with Santhosh. We're still appreciative of people who will review the components, the later components, and also those who will act as mentors. So somebody with your expertise, Timothy, is really much appreciated. Abel Castro says, is this training already running, or will it start later? And then is it mandatory to be in practice to be enrolled, or if anyone is a physician is not currently in practice, may they apply, and how much is the cost? So you could address those, please, Santhosh.
Yeah, this is The applications are out as of today. March 5th, 10th, we'll have the first cohort joining. In the first cohort, we are taking 50 students in year one. Uh, 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 Anybody can join as long as they have had about 2 years of hospital healthcare experience. And even if they are not in practice, but they have had healthcare experience, we need that knowledge of healthcare um, management of how healthcare runs before they come into the course. Otherwise, learning curve will be
Much deeper.
Deeper. That's all.
Yeah. And
The cost, it's $1,000 per year for 2 years.
Okay, so that seems very reasonable for an online cost compared with quite a few courses that I've seen advertised recently. So, Abel, hopefully you'll be applying. Dr. Emmanuel Kamar Charles is asking about scholarships. What's the position on scholarships? And this is for a disabled Christian doctor as well. So, any?
Yeah. Being the first cohort, first program, we still haven't come up with detailed costing at this time, but a limited number of scholarships will be available for people from challenge contexts. ICMD always has a structure by which we look at the needs and respond to it. So once the program application comes in and it is a requirement, people could directly write to the managing team to find more details.
Right.
We're still working on it.
And I think many people on this call will be aware that the recent appeal that went out, the ICMDA appeal, was specifically targeted at helping people on the Diploma for Family Medicine course and helping to fund that. So we want to be able to subsidize where possible, but we also need to break even, and we have partners on this, so we need to be careful, but we certainly want as many people as possible. And if anybody on this call wants to offer donations through the ICMDA offering, then please feel free to do so. So Vanita is asking, may I ask, after completion of the program, graduates will be able to have a postnominal designation to their name?
No, they'll just get a international postgraduate diploma in healthcare management certificate, IPG, DF, DHM. Yeah. There is no designation linked to this.
Right.
Course.
But it's accredited by a very respected university, Loma Linda, so that will carry a lot of weight when applying for jobs. Angela's asking if we missed this year's registration application. Well, you haven't, because it's only open today. But can we also join some part of this year's 20? Well, it's open, Angela. Any encouragement from you, Santhosh, Joanne, Angel?
Yeah, you can't join in between a cohort. There's one cohort joins together. So applications will be on till the last week of February, 24th of February, I think. One from now. So anytime in the next 1 month, you can apply.
Yeah. So please get onto that website and start registering, or circulate the information to those who you think might be interested. Maybe you know people in mission hospitals that don't know about this course that you can encourage to join. Daniel Lim is saying, on top of managing hospitals, will there be a focus on managing in other healthcare settings and other models such as community health programs, hospice, nursing home? That's a good question, Daniel. Thank you.
Yeah, we have tried to incorporate community structures, community engagement, community programs into the module, both in the foundational module, the core modules, and the latter section of the community engagement program. But a lot of it might get covered in the monthly sessions where they come on the monthly program, interact, and there will be case studies from hospitals, case studies from hospices, nursing homes, and try to learn, develop learnings from them. But being a very broad topic, everything may not be covered in the module, but we'll try our best to incorporate some of this in our monthly sessions.
Okay. Josh has put in the chat details about how to apply, so you can look there. Keep your questions coming if you still have questions, but I think most of it will be, most of your questions can be answered at that link. I was fascinated when you said, Santhosh, that AI will revolutionize healthcare management. I wrote it down because I thought, wow, I wonder how that's going to happen. It's obviously post my career in healthcare management, but do you think that's going to be a good thing, or do you think it's like most technology, it's got its good side and bad side?
Yeah, I think there are, in the management side, I think it will be there will be quite a lot of good aspects of AI coming in the management side. I'm not talking the clinical side at all. Clinical medicine, there's a whole other area of AI involvement, and radiology and diagnosis and even clinical diagnosis, everything is happening. But in the management side, I think the data management will become much more easier. Because you can use AI for your analysis, your data management, your coming out with your trends, coming out with your comparative figures. All those will be. I think that will revolutionize the thing. So in the records management, again, medical records management, there will be a whole lot of changes happening. Would it happen in the next 5 years? I don't know. Will it reach the resource poor settings also equally fast? I'm not sure. But I think in the next decade or so, it will completely change. It might affect negatively in sense of that job might be taken over by AI systems, and you may not need so many managers, which is good and bad.
Well, I must admit, one benefit of AI that I've already seen, I seem to spend quite a lot of my first 5 years in healthcare management sitting in meetings, taking minutes, and then taking them away, writing them up, getting them checked, etc. And I'm just amazed at how well AI does records meetings and puts them together into what almost seem like perfect minutes. So that's one thing of healthcare management that's going to be improved.
Definitely. Documentation, minutes taking, report writing, all will become completely revolutionized. So it will free a lot of time from those kind of jobs.
I haven't got any more questions coming in, so I think this might be the last question to ask, unless anybody's got a burning question they can drop in the Q&A. I noted that you said the need is for generalist managers rather than specialist managers. Could you just enlarge on that and why that is?
I'm not saying that specialists are not required, but understanding the context of smaller institutions or resource-limited settings and healthcare programs with minimum number of staff or minimum less resources. Many times management of those programs or institutions or contexts can be done by people who have the knowledge and skill than specialists picking up each area. Because it's like hospitals. If your family practitioner is able to manage the family together instead of a cardiologist and a nephrologist and gynecologist, everybody coming together, it's almost similar to that. But in a larger institution with large number of staff, large cash flow, large financial turnovers, large other systems, definitely specialists are required. But other settings, if you add on multiple specialists in multiple departments, the sustainability will get affected. and the holding together also will get affected. So I'm not saying specialists not required, but the context in which faith-based organizations are working or rural settings or smaller institutions or healthcare programs or community programs, journalists might do the same job, which can be done if they are trained well in knowledge and skills.
Well, thank you for answering that and all the other questions. This is a great day for me, really, to see this launch of the diploma in healthcare management. And your first point in what we can do was pray. And so I'll certainly be praying for it and hope those on this call will be praying for it. But we pray especially for you, Santhosh, and the team that has worked so hard over the last 2 years to develop this diploma. And we hope that there will be many people signing up. So you've got a chance to sign up for the course. You've got a chance to sign up to be a mentor. You've got a chance to encourage somebody else. And I think if there are parts of the program that you want to sit in on and add your advice, then again, do make contact with us. So I think at this stage, all I can do is thank you, Dr. Santhosh, for your time. Thank everyone who's been on the call. So until this time next week, I wish you Godspeed and a really successful week and a fruitful time serving the Lord in where he has placed you. Thank you.
Thank you.